Hello everyone, my name is Andre Ditto and welcome to Ditto Fitness. Today, my guest is Dr. Patrick M. Fratellone, cardiologist. Dr. Fratellone has the distinction of being one of the few integrative cardiologists in the United States. He is also the only integrative physician in New York City with active hospital admitting privileges at 3 hospitals. St. Luke's Hospital, Roosevelt Hospital, and Beth Israel Hospital. Dr. Fratellone is a fellow integrative medicine with a degree from the University of Arizona, where he studied under the directorship of Dr. Andrew Weil, MD. Dr. Fratellone has recently completed his course studies at the Northeast School of Botanical Medicine under the supervision of Seven Song. Dr. Fratellone recently completed his coursework for fellowship as a registered herbalist, the American Herbal Guild, making him one of the few medical doctors in the United States with this distinction. I'm pleased to have him on my show.
Thank you for having me.
You're welcome, Dr. Fratellone. Let's talk about heart health.
Okay.
Obviously, that's your specialty, and what does it mean to take care of your heart, and how can we integrate alternative medicine while we're doing this?
Well, it's an important topic because heart disease is still the #1 killer in the United States among men and women. It surpasses all other diseases. So heart health really encompasses a wide variety of things. And, you know, you said alternative, I'll probably use the word integrative.
Okay,
instead.
there you go.
Only because alternative people think, you know, it's odd.
Yeah, I agree.
Yeah,
I agree.
I like integrative, and that's what the Fellowship in Integrative Medicine is. So basically, it's looking at certain blood tests first. I think doctors, there's certain tests you should do, and there's certain tests that have fallen by the wayside. And really, it has to do with insulin levels or sugar levels. That's important. So if we're going to talk about heart health, we have to talk about diabetes, because we have 2 epidemics in this country right now. And, you know, I wasn't the first to say this. I have to give credit to Dr. Atkins, who I worked with for years. You know, 2 epidemics, obesity and diabetes, and both lead to heart disease. So if we're going to talk about heart health, we have to discuss what you're eating and how much do you weigh.
Okay.
So
Makes
that's
sense.
important. And unfortunately, the American Heart Association has a DASH diet, and then the American Diabetic Association has their concept.
Yes.
And not saying that they are useful, they're useful, but there are other places to look and how to eat. So dietary lifestyle is probably the most important thing to start with. And I like to find out from patients, good heart health is, what do you eat for breakfast, lunch, and dinner?
Okay.
How much water do you drink? How much do you exercise? How much coffee do you drink? So I start off with a dietary lifestyle with the patient, say, let's go through it. And we've done the physical exam, we ordered certain labs, and I examined them, and I found this. But now I want to have a discussion with the patient of a history. So my history in my office includes social history. It includes, what do you eat for breakfast, lunch, and dinner? In this country, breakfast is quick.
Yes. No doubt.
And I think it's usually you know, ham and eggs on a roll or a bagel.
Right.
And those local, you know, these local places in New York City, and I was guilty of that at one time.
Yes.
Or it's a cup of coffee as soon as you get up.
Yes.
And I have a problem. I have no problem with coffee.
Okay.
I have a problem if that's the first thing you do when you get up. After you urinate, are you first having a cup of coffee? Because people have to realize part of heart health is, did you get an adequate night's sleep? And what happens is when you're sleeping, your body becomes acidic.
Okay.
You wake up with an acidic pH. The pH is a balance between acid being less than 7 and over 7 is alkaline. And most of us wake up with we all wake up with acidic pH. And then you had coffee before you ate, so you brought the pH down even further. So we need to alkalinize the body when you wake up and first have some protein. Some people feel, you know, they say, oh, well, you know, Dr. Fratellone, I'm really nauseous in the morning, I don't want to eat. Okay. Would you have a warm glass of water with apple cider vinegar?
Sure.
Would you have a warm glass of water with lemon? People say, well, that's acidic. I said, no, with water it becomes alkaline. So we could alkalinize the body. The best thing to alkalinize the body is protein.
Right.
So so you could have a hard-boiled egg in the refrigerator, but the usual breakfast at home for kids, let's face it, is cereal.
Yes.
And for the person on the go, it's usually, a ham, egg, and cheese. But, you could have a goat yogurt, you could have the proper cereal, you could have a rice cake with almond butter, or I like people who are starting out with me the first time to have a protein drink.
Yes.
So that's how it starts. So I think the first baseline is the dietary. Find out what they eat for breakfast. Then say, okay, when do you eat next? And they'll say, when I have lunch. Now, they could have eaten at 7 o'clock at home, but lunch is 6 hours later. That's too much of a gap. People need to eat breakfast, snack, lunch, snack, and dinner. And they need to have small snacks in between. Adele Davis, who is a famous nutritionist, she wrote a book, Let's Get Well. And I have my mother's copy on the shelf in the office. And you read that book and people say, well, this lady wasn't right. Well, she turned out she was right.
Yes.
She was definitely right. From her King Carlton Fredericks, Marion Nestle, who's still alive today, and she wrote, you are what you eat. And look around, New York actually used to be much better on obesity than it is now.
Yeah, I agree. I
Because
totally agree.
I think what happened is not that they don't walk, but there's too many fast foods on every corner. Starbucks is on every corner.
Yes.
And people think, a quick latte, with a lot of sugar, that's a sugar burst.
Oh, yeah.
And usually people tend to drop their sugar about 3 to 4 p.m. So we're all looking for that. So I think no matter what we talk about heart disease, we have to start with dietary. So that's how I start.
So now, you talked about looking into, you have to look at diabetes, you have to look at being overweight, et cetera. How does this correlate? How does this sort of fit into the mix here that we're talking about?
Well, basically, a diabetic, diabetes is a systemic disease. It happens when you're eating too much blood sugar. Some people started out in their teenage years of having fluctuations in blood sugar. They used to call that hypoglycemia. But classically, hypo means low blood sugar. These are people who all day long went up and down with their blood sugars. They turn that hypoglycemia. The first response of the pancreas, which is the organ that produces insulin, if it sees a high blood sugar because you had a buttered roll, a Danish, and a cup of coffee, okay, that's your breakfast. Your sugar went above 125 within a half hour, and the pancreas then would put out insulin to bring down your blood sugar. But after so many years of eating this way, the pancreas gets confused. It doesn't know whether to it puts out the insulin, but then insulin's supposed to drop. But what happens after so many years, insulin stays up, and then you have what we call prediabetes or insulin resistance, metabolic syndrome. This is when your insulin goes up but doesn't come down. It stays up. Insulin is a fat-storing hormone.
Yes.
So basically, that is the mechanism that carbohydrates are sugar. Anything you eat has a carbohydrate. Vegetables do, fruits. But the main thing is simple carbohydrates.
Oh,
Too many of us in America eat white bread, or let's say white flour. I wouldn't say white bread. We didn't have heart disease in this country till 1921 when we processed Wonder Bread.
Huh, isn't that interesting?
And all those, a lot of those immigrants who came over, my grandparents included, they had, butter, real milk with cream on top. They didn't get heart disease. It wasn't until we processed food. Right. So the problem is those people eat a lot of carbohydrates, up and down, up and down. That leads to high triglycerides. And everyone's obsessed about the cholesterol. It's not the cholesterol. It's the triglyceride is high. That means your good cholesterol, your HDL is low. So we're an epidemic of high triglyceride, low HDL.
I see.
That diabetes leads to heart disease.
Oh, wow. So on top of that now, being overweight, how does that compound it? What is that?
Well, being overweight, you put strain on your heart. Your heart is as big as your fist. So you look at your own fist, say, that's as big as my heart. That heart has to pump 5 liters of blood every minute. The heavier you are, it's a strain on the heart. And the pump function, which is called the ejection fraction, can go down.
Yes.
So, obesity leads to many things. The diabetes, or the increased sugar, which came first? Increased sugar led to diabetes, or increased sugar led to, they're both together. Right. But we do know that those two do lead to heart disease. Now, there are things to do about it. You have to change your diet, and there has to be some exercise regimen, which you're very familiar with.
Of course. Yes, that's what I do for a living. I work as a certified trainer, and so I see this all the time. So what should people do to change this? What direction should they take? Should they just detoxify?
Well, first of all, I think, you have to have a rapport with your doctor. The way the American Medical Association and the way medicine's going in this country, unfortunately, we're getting less time with our patients.
Yes.
I still prefer and I've cut it down, but I used to spend almost a half hour with every patient. I had to cut down to 20 minutes because I have to fit in more patients. But in that 20 minutes, I want to discuss, well, first of all, the first meeting is an hour.
Right.
So you come to the office the first time, it's an hour, and then it's another hour with me. So you get 2 hours. The first hour for me to do the intake and the physical, draw your blood. The second hour after the blood is to analyze it. And we need to start there. We need to look at what their fasting sugar is. We need to see their triglycerides. I'm more interested in the triglycerides than I am with their cholesterol. So you go through the blood work, and we have to set up a program for them. And the program is some people need meals, at least dictated to them. Now, I'm trying to do this, doing the nutrition, because a lot of insurance companies don't cover nutrition visits. So I'm trying to do that. And it's hard to fit in the visit, nutrition, exercise.
Sure.
Now, those patients, unfortunately, who have diabetes and kidney disease can see a nutritionist under insurance. But I try to get it all in, and I try to outline the right breakfast, the lunch, the right dinner. And then people say, well, what is your diet?
Right.
And I well, first of all, I say, because they know I worked for Atkins for years, well, first of all, there's no diet for every person.
That's correct.
It's based on what I find in their blood work. If I had to say the ideal diet, it can't be learned from a book. I don't think a diet could be learned from a book. I think the doctor has to analyze everything you're doing, both integrative and conventional medicine. Like, I want to know what supplement you're taking. People don't ask that. But there is no diet. So if I said the ideal diet is the Mediterranean diet without the pasta and the bread, well, people freak out by that because that's their staple food.
Right.
And being Italian, that was a staple food.
Right.
And I literally, my grandparents lived in our house. My grandfather was a great cook. That wasn't his profession, but he cooked a lot, and we had pasta every single night.
Wow.
It was in a different form, though.
Right.
I mean, on Friday, my brother and I looked for pasta aglio, which is garlic and oil.
Yes.
But on Saturday, on Sunday, it was always with, we call sauce, but that was tomato sauce.
Yes.
But every night, it was with beans on Friday. It changed.
Yes.
We ate a lot of pasta as kids. Now, why I don't think we're overweight? Because it was freshly made pasta. It was, my grandfather made the pasta downstairs.
Oh, wow.
So it wasn't Ronzoni.
Right.
If you're going to get quality pasta, you might escape the diabetes. So, I want to talk to them about that. I also want to talk to them what we offer. And then exercise until I don't exercise. It depends on the age group.
Right.
But the American Heart Association has put out a study, and I quote it all the time, 30 minutes of exercise 3 times a week.
3 times a week, yes.
Decreases cardiovascular mortality, the #1 killer in the United States, by 38%. Now, if you can't take the time for an hour and a half to walk, now someone said, well, I have bad knees. Well, then what about going in a pool?
Sure.
Anything. So basically, I like to find out what the patient likes. I'm not going to tell them to do exercise if they don't enjoy going to the gym. People can't afford the gyms in New York, but they have a gym in their building. Or they're near Central Park, then walk certain. So you have
Certainly.
to, I think the doctor has to really know the patient. The nicest thing I would say about practice, and this is my 20th year of practice.
Congratulations.
The nicest thing about it is I see the grandparents first. I used to see them.
Right.
Now I have their children, and then I have their children. So, when I see a grandparent, I'll ask how's, so-and-so, because that's their grandchild, who I also see.
Right.
Maybe in 20 more years, if it's so practical, I'll see the great-grandchildren. But that's nice because I know the history of the family.
Sure, that is. We're talking a lot about blood test here. I know because I've been a patient of yours, and your blood tests are pretty extensive.
Yes.
As opposed to walking into a regular physician's office and they take your average blood test, not taking anything away from the physician. No. But you're definitely take a much more extensive blood test. Why is that? What difference does that make?
Well, I take the integrative approach. I look at risk factors for heart disease in addition to cholesterol. So as I said before, it's triglyceride over HDL ratio that I look for. There are 5 other risk factors that I look for, and I think it's really important. One is the fasting insulin level, because I want to pick up the diabetic early. Then I look for homocysteine. Homocysteine, these are conventional blood tests for everyone listening. Your doctor could order it, but there's a lot of controversy with each one, but I think it's important to define it, and I'm glad you asked me that about blood tests. So homocysteine is an amino acid, a bad amino acid. And the doctor who really talked about it was Dr. McCulley in 1969, Harvard professor. And he took 100,000 nurses, he did a nurse study, and he decreased that risk factor, which causes aging of the heart vessels in the neck, the carotids.
Carotids, yeah.
Premature vascular damage.
Wow.
And that number should be below 11. And anyone who is higher than 11, he put them on folic acid and B12. Now, simple thing, two simple vitamins. One is methylcobalamin or psychocobalamin, the other one's folic acid. And he found a reduction in homocysteine. Harvard, after 2 years, they kicked him out in 1971 because they said that the vitamin could not bring down this risk factor. And in the 1980s, he received the Nobel Prize in medicine for his work on homocysteine. I think it's a valid test. Now, it does affect people differently. If you have kidney disease, the test is skewed. But there also is some people who can't process folic acid and B12, and they have a deficiency, a genetic deficiency. And that's another test I might do. The other one is lipoprotein little a. It's like the LDL, which is the bad cholesterol, but this is a risk factor that shouldn't go above 75 on certain labs. I see people in 90s, 100s. The problem is it's hard to bring it down with conventional medicine. And this was published in 1972 in the American Journal of Medicine. I'm full of studies.
That's great.
Because I think I want to validate what I'm saying.
Of course.
So lipoprotein A cannot be lowered by any conventional medicine. So this is where my integrative comes in. And I will use coenzyme Q10, which is a strong antioxidant. I will use 2 amino acids, lysine and proline. And I probably use niacin, which is another B vitamin. That risk factor needs to be checked. Because there are many people out there that are fit, and then you find out they had a heart attack. Well, how is that possible? Because they had these other risk factors that no one looked at.
Right.
The other one is fibrinogen, which is a clotting factor. Whether your blood is too thick or too thin. So when I look at, how I explain this to the patient, okay, I want your blood to flow like water, not like ketchup. So is your fibrinogen high, which is flowing like ketchup, or is it low? People get that. They get that analogy.
Yes.
The last risk factor, which has been in the news a lot, is C-reactive protein. And there's two types. The regular general one, which people have high all the time because of, let's say, arthritis and moving. And then the one I check, which is the HS. Or high sensitive or cardiac CRP. This is a direct correlation between inflammation of the heart arteries. So those are the 4, plus fasting insulin. The other one I do for men is testosterone level. A low free testosterone. We used to think it was the total testosterone. It's actually a low free testosterone. It was published in the Journal of Circulation only 4 years ago that we've been thinking about total testosterone. It's the free. If you have a low free testosterone, you're at risk for heart disease as a man. Now, men are at increased risk anyway, but now these other ones. So those are the real blood tests I do. The last one I do on everyone is, I don't see it to be controversial or new, but it's a fractionated LDL. So what that means is most of the time your doctors get cholesterol, bad cholesterol, LDL, good cholesterol, HDL, and triglycerides. I break them up. There are 2 types of LDL, bad with a good particle or bad with a bad particle, and the same thing with HDL, good with the good particle, good with the bad particle. This is called a VAP test or an NMR. It's a fractionated cholesterol. All of this is paid by the patient's insurance companies.
Right.
So I don't understand why everyone should be doing it, especially for heart disease.
I couldn't agree with you more. My name is Andre Ditto. You're watching Ditto Fitness. For those of you who just tuned in, my guest today is Dr. Patrick Fratellone, cardiologist. And we're talking about heart health, and we're talking about integrative medicine, how that can help you to keep your heart healthy and just keep your life prolonged for the most part. What I'd like to do is ask you about, I've heard a lot about what's called IV drips or intravenous drips, better known as. What's the purpose of them? What are they for? What do they do for you?
Well, some people can't absorb. We're in an epidemic, I said earlier, of obesity and diabetes, but we're in an epidemic of processed food. GMOs. You hear about this all the time. I read a daily blog, and last week the blog was on GMOs. And how this relates is some people have been damaged by so much processed food, maybe the water from the metals in the water, the amalgams in their mouth, the nicotine, the air they breathe, that their intestines cannot absorb. And the only way that I could heal them, in addition to some supplements, changing their diet, some herbs, as an herbalist I use a lot of herbs, is to give them intravenous supplements. Intravenous means it is intravenous, it's into the vein, and we put up certain vitamin bags. And some person, especially a smoker, is deficient in vitamin C. So we give a lot of vitamin C. These are people who want to get healthy, who really want to take it the next step. It isn't, say, intravenous is invasive because I'm entering the vein with an IV. We hook it up to a bag. It's a formula I make. I'm a lot of formulations for a variety of diseases. But most of us don't take trace minerals, so we give those. Zinc, copper, and selenium. You need that for your thyroid balance, and you need that just for basic metabolism. We give calcium, magnesium, the vitamin C, antioxidants. So these are people who are malabsorbed, and the reason they're malabsorbed is they have inflammation. Inflammation is the key to everything. So, when Adele Davis said, you need a clean colon to have a clean life, she really wasn't talking about the large intestines, which is the one below. She was talking about the small intestines. So to have free of disease, no inflammation. Because once you have inflammation in the intestines, inflammation goes to the heart, the thyroid, the brain, all over. So I think the intravenous supplements are important. They're not as mainstream I would like them, but people do get better when they take supplements intravenously, not for the rest of their life, but they need to heal the gut. So when someone has a bowel issue, you go into the hospital, they stop you from eating.
Sure.
So we're stopping you from taking supplements and food by mouth for that day, so we can give you intravenous supplements.
I see. Is this for, is it for everyone? And what do you treat with this besides just the gut? What other purposes?
Well, there are other methods you could do intravenously. Recently, the NIH, the National Institute of Health, has completed a study on chelation. Chelation in Greek means to grab onto. And the trial was called the TAC trial, the trial to assess chelation therapy, TACT. It was a favorable trial. I think it was both, it could go pro and con. It wasn't 100% favorable chelation, but it wasn't not in favor of chelation. Chelation is giving an intravenous EDTA to bind to metals or to bind to calcium plaque, which causes heart disease. It's been used since 1955. Clark did the first study with EKGs. Abbott Pharmaceuticals made EDTA.
Oh, look at that.
So, it was a conventional thing in the 1950s and 60s, and then it became somehow integrative. Part of that is ACAM, the American College of Advancement in Medicine, who certifies you by a board certification in chelation therapy. I think people, if they're going to consider it, should go to a board-certified chelation therapist. That could be given IV. Phosphatidylcholine, which is lecithin, we call it Plaquex, that's for soft plaque. That can be given intravenously. There are many things that be given intravenously, as far as one really important one called glutathione. Glutathione is a very powerful antioxidant. We can't get it from food. We just can't. It's highly heavyweight molecule, so the best way to get it is intravenous. It's good for chronic diseases, autoimmune, Lyme's, metals, heart, detox. So these are the kind of things. So basically, I don't want people to say, and I see you go over an IV drip. You basically follow things, but we will assist you in any way to help your disease process.
Oh, it's very interesting. So you're saying that IV drips are basically, you can help pretty much any condition with an IV drip, would you say?
I would say yes, but they have to be tailored to the patient.
Oh, that makes a lot of sense. So what I'd like to do is just back up here for a moment and ask you, what inspired you to become a cardiologist?
Well, that's interesting. I was born a blue baby.
Okay, yeah.
A blue baby means there was some defect in my heart.
Oh.
I was not getting enough oxygen, and I was blue. And actually, my fingernails are what they call clubbed. And clubbed means you had some congenital heart disease. And my parents, we did not that they didn't believe in surgery, but when I was born, heart surgery was a little experimental on children. So I saw a cardiologist and all that. Well, it wasn't until age 45 that I had my heart opened up. I really was a cardiologist before that, but I think I went into cardiology because I knew one day I wouldn't have to have open heart surgery, which I did. At age 45, I had open heart surgery to have some valves replaced. So that was my, help there. How I changed that to integrative is I used to be given a lot of herbs when I was a kid. They always say that the Italians have little herb gardens, and I was given herbs, which I think helped my heart stay healthy. And that's why only 3-4 years ago I went to get a degree in botany and herbology because I wanted to use herbs.
Oh, that's pretty amazing. That's pretty interesting. It sounds like a situation where you overcompensated for your own just well-being.
I took Yeah, I took, something that could have been negative, and I think that's the way I go through life. I always look at the positive end and have positive mantras. I was exercising, but I saw the dice, said, you have to go. And, there comes a point as an integrative physician where you have to take the best of both worlds. And the best of both worlds for that was for me to have an operation. I wouldn't be here. So same thing when patients come with valve. There's certain times you need a valve replaced. I try not to, but I do both.
I see. Once again, my name is Andre Ditto, and this is Ditto Fitness. My guest today is Dr. Patrick M. Fratellone. He's a cardiologist who uses integrative medicine in his practice. Dr. Fratellone, if any last words, how would people can get in touch with you?
I think it's something like this, and thank you for this. This is education. I think we have to empower ourselves. And I think the best way to empower ourselves is to educate ourselves. There was a quote on my blog, medicine is not taught at the bedside. Medicine is taught at the bedside, not in books. Because you need to talk to the patient. The patient has to educate you. You're educating people today. There are people going to shut off this phone and say, what just happened here?
Right.
Which is what we want. And that's what I want for many movements, including plants. Integrative medicine is a big thing. I went to a certified program to show people that it does work. So I want to empower themselves. That's it.
Oh, that's wonderful. It sounds like you really have a thriving practice, obviously, and it sounds like you've been quite the teacher in your practice.
I like to teach.
Which is fantastic. If people wanted to get in touch with you, how can they do that?
They could do that by logging onto a website. It's www.fratellonemedical.com. Fratellone is F-R-A-T-E-L-L-O-N-E medical.com, and you could find out all about the practice.
Oh, fantastic. Thank you very much for appearing today. Here we have a person who provided us with tons of information today, and just stuff that you wouldn't hear if you turned on your TV, for sure. It's something to just absorb, to just be involved in, and to learn more about. Once again, my name is Andre Ditto, and this has been Ditto Fitness. I want to say thank you very much for tuning in today. Namaste, and remember, your health is my concern.